Are you trying to get pregnant? And do you think that your body is trying to do something about maybe why you're possibly having some challenges? Have you ever thought that your menstrual cycle was not the way it was supposed to be, but didn't know what to do about it? Well, that's what we're going to talk about today. So you're in the right spot. Let's dive in right away. I am Denise Noyer-Erez, and I am known as the Fertility Godmother, and I help women prepare their bodies to get pregnant, stay pregnant, and have a healthy baby. And I do that in my clinic in Westlake Village, and I also do it throughout the country and sometimes even around the world. So much. And today we're going to talk about your menstrual cycle, because I believe that your body tells you everything that you need to know about your health. And it's just important to listen. And there's so many tips that your body will give you. So for example, one big thing about the health of your reproductive system is your monthly visitor. Every month, your period is going, it tells you, gives you some clues, and what happens throughout the whole cycle, right? So you have your period on day one, and if you should, a normal cycle should look like is you should maybe feel a little sensations in your lower abdomen, so, like something's going on, because there's a lot going on to make that happen. And then you should start to bleed, and it should have a nice flow, and you should have enough flow to where you're changing. Hopefully you're using an organic pad or tampon, so you don't want to add any more chemicals in that area. So if you're not, then let's switch right away to an organic pad or tampon, or even some people are using the cups. They like those cups. I'm wondering what you think. Would you like those cups? If you like those cups, give me a thumbs up if you've tried that. But anyways, it's really important to make sure that you're using that. And then you want to change where you feel like you need to change every few hours, like 3 or 4 hours, you should be changing your pad or tampon. And then you should stop bleeding at around 4 days, plus or minus a little bit. It doesn't have to be exact, but that's it should look like. It should not have any clots. You should have nice, fresh red blood, and it should be really pretty, just like a normal thing. You don't want to, you might feel a little more tired, a little bit more moody, but it shouldn't be something that it's knocking you out, where you're like, your partner doesn't recognize you, your family and friends don't recognize you, because you're just in this mood and you don't want to be disturbed or so irritable and sensitive for several days or even weeks before. That tells you something right there, that there's something wrong. And then what should happen is around the middle of your menstrual cycles, when you're ovulating, and your body tells you what that looks like too, when you're ready to ovulate, because you're going to be getting that, you probably know, the fertile mucus. And if you don't know, then what it is it's this clear, stretchy, kind of egg white that comes out and around the time of ovulation, and it helps the sperm get up into the fallopian tubes, and helps fertilize and helps get things moving. So that fertile mucus is so important to make sure that you have it. And then, hopefully if you get pregnant, everything looks good. But if you don't, then you'll start your menstrual cycle again. And it should be around 28 days. You want it to be around 28 days. So if you're having a short menstrual cycle, the challenge with that is your egg doesn't have enough time to mature, so that it's not ripe enough, if you will. So you're going to have a harder chance of having it fertilized. So you need to make sure that you're having a long enough window for that egg to grow and to mature and then to be released. And then the other thing that can happen is if it doesn't mature fast enough, then it becomes too ripe. And again, there can be a lot of problems with having a long, what they call follicular phase, that first phase in between your period and your menstrual cycle. That can become, if that becomes too long, then you can have a challenge on the other end. So there are actually things you can do to correct that. But first, I want to give you some more information about what to look for about your body. So when you're doing, if you are ever doing a body temperature called the BBT chart. There's a lot of wonderful apps. But if all you do is you take your temperature first thing in the morning before you do anything else, and you jot it down or you put it in your app, and it's going to track your temperature. And one thing you can pay attention to is, when are you getting your fertile mucus? I've seen many women who start the fertile mucus earlier, but before they actually ovulate. And then they're already dry by the time they get to ovulation. So that's something that we would know that we need to correct. So we need to be able to correct that. And I see it a lot. And it makes sense, right? If you're in ovulation, if you're cervical fluid, your body's telling you that you're ovulating earlier than you are, then we need to get that corrected. Makes sense, right? And then, so the other thing is if you have a short luteal phase or after ovulation, it should be around 14 days before you start your period. If that's short and it's too short, some women have like a 10-day luteal phase. They ovulate on day, say, 14, and they still have a 24-day period. So then we have to figure out to correct that. And sometimes there's a problem on both ends. So it's really, really great to pay attention to your menstrual cycle and know what your body is telling you. You know, is your period regular and no problems? Are you having healthy circulation down there? Because you'll be able to tell by the quality of your blood, the lack of pain, and not having the moodiness or being too fatigued. A little bit is normal, but if it's really, noticeable, and then you know that your body's trying to tell you something, that it wants help, it needs attention, something's not right. You shouldn't have a lot of pain. That should not be happening. You should be able to, have a normal day throughout your whole menstrual cycle. The other thing that can happen during your menstrual cycle, and I just got a question about this, was about spotting. This random spotting around ovulation and carrying on before your period. So if you have spotting, you want to make sure, first of all, that you don't have any fibroids, any cysts, any polyps on your cervix or in your uterus. You want to make sure that everything is good. You want to make sure that everything's healthy and that there's no physical barriers. And if your hormones are balanced according to the blood tests, your progesterone levels are fine, then it's like, what else do you do? Well, from Chinese medical point of view, we look at the body completely differently. So what I do when I have a woman that comes in who's spotting for a long period of time, whether it's before their period or after or both, we work on strengthening whichever system is weak. And usually it has to do with a weaker digestive system. So, and there could be physical signs of digestive system, but that itself is one. So I would work on strengthening that organ, strengthening that component, and doing that through acupuncture, and doing that through herbs, and always diet. But what's going to really make the needle mover is going to be the acupuncture and the herbs. And specifically, what works for me when I work with women who have this condition is moxibustion as well. So moxibustion, herbs, and acupuncture really help with that type of spotting before or after your period, because you should, again, just start your period. I loved it. Just yesterday I had a woman, she was like, I couldn't believe I started my period. I didn't have any sensations at all. She was just like, it just kind of came on. It was a surprise. And she knew she was going to get it, but it was so surprising because normally she would have pain for days. And those are the best. Any type, I love to get results. So that's awesome. So again, just as a refresher, you want to make sure that everything is regular and balanced, and listen to your body, because we're just talking about your menstrual cycle here, but your body's always telling you and giving you clues about an imbalance that's going on, and it could be something that is preventing you from getting pregnant. So if you're just trying to get pregnant, get your body regular, because it does take time. It's not something that happens overnight. It can take 3 to 6 months depending on how irregular your menstrual cycle is. So we've had women who've come in who haven't had a period for over a year. So it takes usually around 6 months to get to be regular, to be a more regular and count on that menstrual cycle. So, and then we've, women who have just a little bit of irregularities, we can get them pretty like clockwork within about a few months. So just know that it takes time and that your body will tell you everything. Make sure to subscribe to my channel, and thank you for your time today. here on the Tea with the Fertility Godmother, and I will see you next week. We'll continue our conversation. If you have any questions, please comment below, and I'll be happy to answer them, or shoot me an email. And I will address it here, or I will send you another email back. All right, here's to your health, happiness, and fertility. Make sure to subscribe and make it a beautiful day.